This is the second video about the case of a young patient who had got fractures of both pubic bones in the second zone according to Nakatani and a fracture of the lateral bone mass of the sacrum, Dennis 1-2. In previous series we carefully explained the process of osteosynthesis of the pubic bone. If you haven't seen it, please check it out on our channel. Now we are going to analyze the osteosynthesis of the second pubic bone since some details of the process were different. In case of bilateral injuries, the first nail serves as a good reference point for the second guide wire. The wire is directed to the space above the hip joint. At the inlet view, insert the wire from the same point as on the opposite side. Remember to preserve the inner cortex when inserting the wire and reaming. As in the previous surgery, we slightly bend the tip of the nail to guide it through the narrow, curved canal. However, even before approaching the hip joint, it becomes clear that the nail will not get around it. So we bend the tip of the nail more and repeated insertion into the pubic bone. At the second time, I approached the acetabulum, but you can see that the bend was still not enough. The nail was very close to penetrate the subchondral bone. Attempting to rewind it with higher pin position was unsuccessful. Then we bent not only the tip but the nail itself, and it finally passed over the joint. After that, we made sure that the nail goes along the canal correctly, and then focused on sinking the nail to a sufficient depth using inlet view. Check out the final curvature of the nail. Locking was performed in the same way as previously. We controlled the passage of the drill bit and the screw using the oblique inlet view and obturatory view. An attempt of locking with a second screw was unsuccessful due to the bone defect in that area. Post-operative CT scan shows that the nail and the screw are installed correctly. Keep watching us. Next video is about sacral screw installation in this patient. Don't forget to ask questions and comment. Till next time!